Our next speaker, again, a lot more to say that's in the formal biography. Deanna Durica has been leading the lead poisoning prevention and healthy homes unit at the Cook County Department of Public Health for 5 years. Her work in the unit centers on building support for healthy housing in the region and also includes work on early childhood, quality improvement, and chronic disease-related initiatives. Before coming to DPH, she worked on early childhood health and education policy as a staffer in the Governor's Office of Early Childhood Development and as a senior policy associate at the Ounce Prevention Fund. Welcome, Deanna.
Thank you so much. We're so glad to be here today and glad to be here with our partners at the Chicago Department of Public Health. And I think that Court set things up so nicely that we share, obviously, a lot of the regulatory rules as far as how screening works. So I get to kind of benefit from Court setting the stage and then talking about some of the other pieces that really influence the way that this plays out in suburban Cook County because of the allusion Anita made earlier about how we have so many municipalities that are working together. So we're looking at kind of addressing things over 125, 29, I can never remember, municipalities and unincorporated areas in suburban Cook County that all have their own rules and, as you'll see, designations about whether or not those children need to be screened for lead poisoning. Okay, so Court already went over that, I think. But here, I think the one thing I want to point out is that I'm going to use the words testing and screening to mean different things. And sometimes in lead, we use those terms kind of interchangeably because getting a lot of feedback from that. Because of the way things work in suburban Cook County, it's really important that we draw a distinction between those two words. So evaluation means a blood lead test to check whether or not there's an elevated blood lead level. Screening means the doctor is supposed to, or the medical provider is supposed to sit down with the family and go through a 8 or 10 questionnaire, 8 or 10 question screening tool to see whether or not a blood lead test needs to happen. So we've got different mechanisms for addressing lead poisoning with kids. So you see here that the provider shall test the children for lead poisoning when those children reside in an area defined as high risk. And then in low risk, there's the evaluation. So the testing or the screening. Okay. We've got a few slides on statewide trends in lead testing, and we'll show you kind of how our data compares. But as the other speakers have shown, you can see that there's the testing rate here in Illinois has been pretty consistent over the last several years at about 25% of kids. We're higher than the U.S. testing rate, which is good. I think the piece of that that's not so good is that we have a lot more lead here in our region, and that probably drives the higher testing. Illinois and U.S. children tested, and these are blood leads at 5, right? So a venous blood lead of 10 in Illinois triggers a public health intervention. In our rule right now, even though there's been since 2012, I think the CDC advisory panel on childhood lead poisoning has recommended interventions at lower levels because of all of that evidence you've been hearing about the way that really low lead levels affect children's development, that intervention should be happening as early and as low levels as we can. In Illinois, the law is still 10. And so you can see here, lead levels are the blue lines for 10 micrograms per deciliter, and then these kind of stripy bars are when Illinois started to take a look at 5 micrograms per deciliter over time. So you'll see, as our other speakers were talking about, how lead levels are consistently going down, but we still have this issue, right, with a lot of kids who have this, 5 or greater blood lead level where we're not intervening, but we know we probably should, and we know that kids are affected, right? So while those numbers are going down, and lead is kind of one of those success stories in public health, we know that there's still a lot of work to do because of the way that lead affects kids at really low levels. Okay, so again, those differences between evaluation and screening. The evaluation is performed using this questionnaire, and this should happen on children before they attend a licensed childcare, school, or kindergarten as required by the law, as court reviewed for you. Testing is required for children residing in IDPH designated high-risk zip codes. Now, within our jurisdiction in suburban Cook County, only 12 of our 129 municipalities are designated as high-risk zip codes. You saw in court's information that every single zip code in Chicago is designated a high-risk zip. So there's a requirement for testing children who live in Chicago, but just the west side of Austin Avenue, for instance, you might not have to be tested, or just south of, I don't know what the border is on the south side, sorry, Southsiders. The children who answer yes or I don't know to any question on that screening tool are supposed to be tested, and then any child who's Medicaid eligible. Now, unlike the city of Chicago that has that kind of more robust periodicity for testing, in suburban Cook County we are regulated by the state law that says at 12 and 24 months is when those tests happen. So we don't have that same kind of intensity around 3, 6, 9, 12 months for required testing. In our program, nursing home visits and environmental lead risk assessments are triggered by that 10 micrograms per deciliter blood lead level, and any child, regardless of blood lead level, can receive that environmental assessment and nursing home visit if they are referred to us by a medical provider. So that kind of sets the stage. This is so weird. So we took a little, we've been looking at some data from 2004 to 2013, and I'll share a little bit of the preliminary information that we've been able to glean from that data. So in that time period, we had 45,000 children who had blood lead levels of between 5 and 9. So we're talking about a significant number of kids who reside within suburban Cook County who have blood levels that we know are affecting their development, who are not legally entitled to services in the state of Illinois, right? So our law has not yet caught up with the science for what we know is good for kids. In that same time period, around 7,000 kids are 10 or greater. So again, while those numbers are going down and we see those bars in the chart kind of with that reassuring slope where we know fewer and fewer kids are being affected, we're still talking about over 7,000 kids who have had significant, impacts on their developmental, cognitive, emotional, behavioral development because of lead. And then you see we kind of broke that same 52,000 kids down for the kids younger than 3. So we see 50% of the kids were younger than 3 in that sample. Okay. So this is just a comparison, again, and thinking about the way the law kind of drives who gets screened, who gets tested. In suburban Cook County, in 2014, we had almost 25,000 children receive the blood lead test, and you can see the results of those tests there. In Chicago, almost double that. Again, when we're talking about kind of similar populations, you'd think that the screening would be similar. We think really that incongruity in the who is required to have the blood lead test is really bearing out in some of this data. We've got a couple maps here to show a little bit of where we know some of the risk to be. And like Court talked about, and really wanting to move from we're going to respond to a problem posture to a we want to prevent the problem before it begins posture. This kind of data is really important because it helps to really center the work that we're doing in areas where the risk is greatest. So this is a slide that shows us incidence of blood leads 10 and greater in suburban Cook County. So see, we don't have any Chicago data there. Court shared that with you before with his community areas. And the red and orange areas are the areas where the incidence is highest. We've got Cicero and Berwyn being kind of a hot area, Melrose Park, and the south side, Harvey, Chicago Heights. Interestingly, the west zip codes there, where we see a lot of lead poisoning, are high-risk zip codes as designated by the state, so we know that those kids at least are supposed to be getting blood lead tests. On the south side, we have many fewer zip codes that are high-risk zip codes as designated by the state. So legally, a provider would not need to test that child unless they were Medicaid eligible or answered a yes on that screening tool. But I think that any parent here in the room anecdotally can provide some evidence to the fact that doctors don't always provide those screening tools to parents. They don't ask those questions. And as Dr. Bin said, it's really hard to get a venous on a young child, right? And so sometimes the easier thing is to just kind of wait and see if that happens at the next appointment, right? And there we go. And we've got the same kind of map with incidence at 5 to 9. So we took a look at those lower leads. Again, you see some of those west side zip codes as being places where we know that the incidence is high. And then again in the south. So these, we're going through our health planning process in suburban Cook County right now with our health department. And truly, in thinking about where we need to focus our work, this is kind of a refrain that we talk about a lot. We talk about west side communities, we talk about south side communities, right? And this we talk about when we're talking about chronic disease, how there are health disparities in these areas. It's similar now when we're talking about lead, right? So we know that issues are similar in communities that are vulnerable, whether we're talking about lead or chronic disease or food insecurity, whatever it might be. And so it really is important to kind of use the surveillance data, not just to kind of trot it out at meetings like this and be excited about the bar charts and maps we can make, but to really let that drive program and policy so that we're putting our resources where our most vulnerable children will benefit the most. I've been talking a little bit about this high-risk zip thing in Illinois. So you see those 12 zip codes at the top are the 12 zip codes within suburban Cook County, our health department's jurisdiction, that are designated as high-risk zip codes. So you've got Kenilworth, River Forest, and then you have Cicero, Berwyn, Hometown, Blue Island, Maywood, Bellwood. So you can kind of see those zip codes. These are the ones where if a children shows up at the doctor's office and lives in 60402, you're supposed to get a blood lead test. Again, we know that that doesn't always happen, right? Because I'm not sure how actively physicians are monitoring what zip code their patient comes from. If you can imagine a multi-community practice, keeping track of every zip code every patient shows up with might not be the easiest thing to do. And interestingly, when you look at some of the data, and this was data that we pulled from the Lead Risk Index, which is a national data site that has put together estimates for prevalence for lead poisoning, the zip codes that are not considered high risk by the state and therefore testing is not required are very similar looking to those ones above it, to the ones that are the high risk zips where kids are supposed to get blood lead tests. So if they look the same, right, one would think that perhaps the policy and practice should be the same, that screening and testing should happen here as well. And that is something that I think the state's been struggling with. We'll talk about that a little bit more in just a moment when we're kind of talking about implications. We've got a map here. We talked about where the lead was. So if you remember that, this is children under the age 5 below the federal poverty level. So you see the darker colors are kind of in those similar places where we saw the dark colors for where we saw the most lead. So again, kind of laying over some of these risk factors, we're seeing that it's vulnerable communities or vulnerable communities. We did some preliminary analysis with this data that we made the maps from and tried to do a little bit of, and this is not work that I did, but our epidemiologists worked on, did some mapping and logistic regression around putting all of the data together. And what we found is that low educational attainment, low median income communities that were high in minority status were statistically significant predictors for the prevalence of lead poisoning. So we took a look at the highest educational attainment and lowest educational attainment by census tract, and we took a look at how those risks compares. So again, instead of waiting for a child to be lead poisoned, instead of waiting for them to be tested, this really drives some of the policy work that we can do in order to get in front of it and keep those kids from being poisoned in the first place. Recently, a working group at DPH revisited that high-risk zip code designation and discussed other better approaches and frankly didn't really come up with anything. Kind of said, we know that generally everybody who's living in a pre-1978 home in Illinois may be at risk. There could be some paint that is kind of degenerating there. And that may be a way to think about it. Oh, maybe it's this kind of minority or poverty or educational attainment stuff. Nobody came up with anything yet as a better way of thinking about it. But I think one of the things that's an issue for me is when Court was talking about how CMS is thinking about targeted testing, and instead of widening that bucket for who would get the blood lead test, there's a kind of national movement to maybe narrow that a little bit and try to figure out, maybe not the best thing when we here in Illinois haven't been able to figure out what the best way to funnel that might be, right? So one of the things, so so what do you do about it? One of the things we've been doing is taking a look at provider practices in areas where we know there's a lot of risk, and contacting them to encourage screening, whether they're a high-risk zip code or not. So we talk with them about the requirements and recommendations in the law. We kind of use the carrot with the rewards, the pay for performance, if for Medicaid kids that Court was talking about. And we let them know about the remediation assistance that is funded through the Cook County Lead Poisoning Prevention Fund. We fund some projects in Chicago and in Evanston, this year in Oak Park as well, and then in suburban Cook County to remediate lead hazards, to try to encourage providers to do that testing, because there is indeed something they can do about it after that. If lead hazards are found, there's assistance for low-income families to help remediate those hazards. Really quickly, because I've already gotten the 5-minute hook there. Here's a slide that just takes a look at how many housing units are census does pre-1980 instead of that pre-1978 number, so it's not totally clean, but we've got over 700,000 pre-1980 units in suburban Cook County, almost 150,000 pre-1940. In public housing, again, because of the attention that's been on that in the media, we did some analysis and took a look. Data from our Stellar was examined to see if there were any past cases who resided in any housing authority of Cook County homes, and found that there were no, that they were not the residents of record for any open lead poisoning cases. And we've in fact had conversations with our housing authority folks and have shared this information, and have said, so if HAC-owned property, if public housing developments might not be a risk, what might be a risk? What might we be talking about? And so this gives us a good opportunity, and they're really open to working with us around how they do inspections and how they kind of make rules about who gets to move in a hazardous apartment in their voucher-supported housing. So it's great to have partners in the Housing Authority of Cook County who are open to thinking about this issue, caring about it, and working with us. Can I have one more minute? I'm sorry. Court provided some information about sources of lead exposure. Again, like Chicago and suburban Cook County, the source of lead exposure is overwhelmingly paint-based hazards. When we took a look at the last 4 or 5 years of data, about 65% of our exposures were lead-based paint. Interestingly, almost 25% of our exposures were things that were not paint. Pottery, imported pottery, particularly from Mexico, candies, makeup, spices, home remedies. So we're seeing a lot of kind of culturally based products that are presenting risks for kids in suburban Cook County, and our inspectors are getting better and better at kind of quizzing families to identify those sources. So in suburban Cook County, water testing is a different animal than in the city. The Illinois Department of Public Health has jurisdiction over non-community water supply testing, which are parks and schools. The EPA has jurisdiction over community water supplies, and you can see what designates that. Community water systems have to test for lead and copper every 6 months. They can do it less frequently if they have no history of violations. Compliance is based on the 90th percentile, so they look at all their samples, and if 90% of them are below 15 parts per billion, then they're okay. There's a link there to show you where those results are aggregated. This discussion around Flint and lead, and then knowing we were coming here to talk about what's going on with water systems and lead, has really opened up some opportunities as we've talked to some partners in DPH and the EPA to figure out how we can better collaborate with those 129 community water systems within suburban Cook County to figure out how they're doing their required outreach and education after they do testing in their communities in order to make sure that folks have the information they need and understand what that means when a sample may come back high. This is my last slide. So again, in kind of that now looking ahead and what do we do with all of the surveillance information and how do we let the data drive practice? I spoke a little bit about that Housing Authority with Cook County partnership that we're really excited about. We've been partnering with the Cook County Bureau of Economic Development as well as municipalities and municipal groups like the South Suburban Mayors and Managers Association, the Metropolitan Mayors Caucus. You can imagine if we have 129 different municipalities, 129 different mayors, and many, many different communities who are writing their own community development block grant applications and are supposed to be paying attention to lead poisoning in their communities. There's a lot of variability over what folks are doing in all of those places. So to work with some of these associations that aggregate those folks, put them together, and help to disseminate best practices is a really important step in being able to reach more than just one mayor at a time. Like the City of Chicago, we hope to embark on a risk and predictive model with the University of Chicago and with our partners at CDPH. We're moving forward on one of the recommendations that came out of the summit in 2014 to look at how we can incorporate visual inspections into work that other folks are doing, home visitors, for instance, when they go out into homes. That was fast. Sorry. Oh.
I want to thank you, Deanna, and our speakers today. We have created a very ambitious agenda, and we've asked them to cover a lot in a short period of time, so thank you for speaking 90 miles an hour, and we hope that it's not disruptive to those of you to follow. Again, I think your talk highlighted the importance of data and the relationship to policy and promoting good policy around lead prevention. I think you also demonstrated that, again, the earlier comments that this is really a social justice issue, human rights issue, and looking at lead is related to other health disparities and some of the overlap there. And I think I really like that you ended your talk with some of the successes, but also being very frank and honest about opportunities for improvement and some of the gaps. And opportunities for collaboration and action with several other agencies, both public and private. So thank you very much. We look forward to continuing this conversation after a 10-minute break. We are so tight on time, we're going to be really diligent about that 10 minutes. So help yourself to refreshments. The restrooms, as I mentioned, are by the elevator banks. Validate your parking, and we'll see you back in 10 minutes. Thank you.